I think just creating a space and environment for those open conversations is priceless to positively impact people's lives. And there's so many things that I've learned just from being in the world that we're in that is life-changing, valuable information.
Trust me, I have a blocked bowel. This is exactly where it is. You need to do surgery right now or I'm going to lose my bowel.
Hello and welcome to today's episode of Health Applied.
So in today's episode, we're going to be talking about our why. We thought it would be really nice for everyone to get a really kind of authentic introduction to myself and Harriet and exactly what we want to achieve with this podcast and all about our personal experiences that have actually fed into why we're here today.
Yeah, I think so. And I think because we're relatively early on in the podcast journey, it's quite a nice opportunity to have it just us today, no guest, and a real deep dive chit chat into why are we here? I've been talking about a podcast for a while.
Yeah.
And obviously Health Applied is such a, I say focus, but it is quite a wide topic because health can encompass so much, and just a nice little casual opportunity to chat together about what brought us here. So do you want to kick off with your why? Why Health Applied for you?
Why Health Applied? So as you know, I have spent pretty much my whole adult life battling health problems. I have had over 32 general anaesthetics. I have had abscesses all over my body. I've had SIN3. I've had a cone biopsy of my cervix. I have had a growth/tumour on one of my tonsils. So I've had half tonsillectomy. I had a hole in my heart, so I've had heart surgery. I had a mini stroke, so TIA. I've had chronic UTIs for 12/13 years. I have ulcerative colitis, so I live with inflammatory bowel disease. And I think the key thing for me with solving all of these, and some of them can't be solved, like my UC, ulcerative colitis, you live with, you cannot necessarily solve it. It's not that simple, right? What really has changed for me is having patient empowerment. So being able to understand enough medically that I can challenge doctors.
Yeah.
I can ask
and
for a
you
second opinion.
There's so many times you're misdiagnosed and because of what you know, you're able to push them in the right direction.
You've just reminded me, endometriosis.
Yeah.
So I was misdiagnosed for nearly 10 years, 8 years, 10 years with endometriosis. I've had prolapsed disc. Do you remember the time they found a tumour in my spine?
Accidentally.
I literally have a tumour right now in my spine around where my bra strap is, and they've said to me they need to monitor it. I have actually forgotten, this is really bad. I need to go and have an MRI. I'm meant to have one every 6 months to check on that it doesn't grow and impact. But I mean, I'm sure I'd notice if I was suddenly crippled, right? I do need to.
What's happening all of a sudden?
I do need to go and get that checked. But in all seriousness, the thing that has helped me manage all of these things is information.
Yeah.
And by having the kind of conversations that we are having today and that we will have on Health Applied, the podcast, and the standard of guests and scientific experts and doctors and research providers that we will invite on as guests, we're going to be able to provide all of our amazing listeners with day-to-day understanding of sometimes basic, sometimes complex health problems or challenges and get that information out there in a way that is actionable for the everyday person.
Yeah, that's incredible. My gosh, you've been through it.
I know. I'm sure there's things that I've forgotten off of that list. I'm like racking my brain.
Despite all of that, you're like the most positive person I've ever met. Like, you're so can-do. You never let that hold you back.
No.
Has that been hard? Like, how have you stayed so positive through it?
Do you know what? I actually don't know. I think ever since I was as like far back as my memory goes, probably 5 years old, I had this internal self-belief, and I don't know where it came from, but I believed I could do anything, like most children can. But I never grew out of it.
Oh.
And my confidence has gone sometimes. Obviously, I've had a lot of challenges over the years with divorce and tricky relationships and things. My confidence has gone, but my self-belief never has. Yeah. And I'm really intrigued, actually, into how children are kind of deconditioned over the years with that self-belief, because most people are with general society.
Yeah.
But tell me about your why, because it's different for all of us, really, isn't it? But why do you feel passionately about Health Applied?
It's an interesting one. I think over the last decade and a bit, I've obviously seen you go through all of your health challenges, which is heartbreaking.
Sorry about that.
And no, you can't help it. But a lot of the time, I swear, whenever we go abroad for a business meeting,
Oh, God.
it ends up in an ambulance. The amount of countries we've been in an ambulance in, the amount of heartbreaking for you. And but I think one of the highlights was we were at Vegas.
I knew you were going to bring that up.
We were in the Wynn,
You bastard.
which is my favourite Vegas hotel. And oh gosh, don't. It was awful but hilarious. So who was the DJ that was playing?
Oh, David Guetta.
He was playing, and Kelly had a really bad UTI. And Kelly said, I really don't feel like going to a pool party, DJ. I'll stay in the room. Fast forward a few hours, and we were having an ambulance call to the hotel room. You were so poorly, bless you. I have witnessed so closely the hell you've been through so many years. And because of the industry we work in, so for over a decade now, we've run a healthcare, well, not specifically healthcare, but an agency that has a lot of healthcare clients. So working so closely with incredible main global pharmaceutical clients. But in that, you become so aware of health and you naturally become a lot more knowledgeable in this space.
Yeah.
And there's things you absorb and you just take it for granted. So from experiencing everything with you, what we've learned now about a multitude of things, including like chronic UTIs, that's really valuable, life-changing information.
Yeah. And do you know what? One of the things that has really kind of taught me a lesson over the years is that we as patients, as human beings, we rely on the expertise of the doctors and healthcare professionals around us. Now, most GPs, they're general practitioners, they know a lot, they don't know everything. Secondary care, so when you get through to your urologist, your gastroenterologist, your gynecologist, etc., you then expect them to have all the knowledge. They're still people. They've been through their medical training at a point in time, which for some of them might have been a long time ago. A lot of them will feel very passionately about keeping up with the industries that they're in, but things change. And unless they are continuously learning and continuously reading white papers and research, they are just people the same as us. They have the same access to the resources and research that we do. Now, that's not to say that every single person is going to sit there and read a load of complicated medical white papers, because most people won't be able to do that and interpret it. And what I think is a really important role for us to play in this is starting a conversation. We've been at an event recently, for example, where a GP was talking about her knowledge on a particular subject. Now, I was sitting there as a patient knowing that 70% of what she was saying was factually incorrect. And I was sat there almost buzzing on my chair, wanting to say, that's not true, that's not true.
You're behind me going, oh.
And I was like, that's what scares patients into getting help. That is not true. And do you know what the truth is? That's what she knows.
Yeah.
And that's where the problem is, that we have relied for too long on healthcare professionals who are incredible and they are so knowledgeable.
And they have to know such a wide variety of things that it's hard to be that expert.
Exactly. And we know through KVA, so KVA is our digital communications agency, which predominantly focuses on healthcare, but regulated industries and lots of other industries in between. But in healthcare, we know one of our challenges is trying to engage busy healthcare professionals. So there'll be a new drug to market or a new treatment or a new pathway, and we will work out how can we best reach those healthcare professionals with that information so that they can then inform and prescribe to patients where it's relevant. And we know how hard that is because GPs, HCPs, healthcare professionals are so busy. They don't have time, but also they're people, right? And that's why there's rise of social media. But then you get the misinformation. And what we want to do through this podcast is crucially make sure this is not an opinion-based conversation that me and you are having. We are making sure that anything that we're passionate about, that we are covering, is all fact-based. And yes, we're going to have our own opinions, but what we need to have is a credible expert in that space who can say, hey, wait a minute, I'm going to challenge that. And probably as a patient, I will challenge them right back. But that's a healthy debate, but it's also backed by science and understanding and data where appropriate.
Yeah.
That's what I really think needs to change, is that patient empowerment piece. We need to take ownership of our own healthcare now. Like, no one else is going to do that for us.
Yeah, and I think patients know their body more than anyone else. Also for healthcare professionals, like if we create a space where we know on those individual subjects, we're lucky enough to have the most talented professionals and experts join us in a conversation. If you think of who can be listening, it's your patients, it's also your healthcare professionals.
Yeah.
It might be, I mean, we're definitely going to do an episode on UTIs.
Yeah, oh my
and
gosh.
have the most amazing expert in that space join us. Watch this space. However, think of all the healthcare professionals as well as patients who could listen and
absolutely
think, wow, there's so much more to this than I initially thought.
Yeah.
I think just creating a space and environment for those open conversations is priceless to positively impact people's lives.
Absolutely.
And like so many people could feel like they're in a rut and listen to a podcast or get recommended a podcast on a particular subject and feel empowered enough again to take control of their own life, because there is nothing more mentally debilitating than struggling with your health.
Yeah.
Like, it is just crippling.
It's so true. And I think even if I take my own individual examples, I had a 6-week inpatient stay with a UTI, which was very, very serious, and it was misdiagnosed for 4 weeks in a big London private hospital. I knew that I had a UTI, and I knew that that was the reason I wasn't getting better. And I kept saying, I have a UTI. And they kept sending me in, doctors, we'll do a dipstick of your urine. And I was thinking as a patient, oh, that's saying negative, therefore it's negative. Let's do another one. That's also negative. Oh, it's negative. Then they would send it off to the lab. Now, the NHS labs will try and grow bacteria to see what kind of antibiotic you need and to determine what kind of bacteria that is, whether it's E. coli, which is the primary cause of UTIs. For my case, I needed to have mine sent to a special laboratory, and mine only grew the bacteria on day 5, I think it was, which meant that all of the times that hospital has sent the sample off, they kept saying there's nothing there, there's no bacteria, there's no issue.
Yeah.
And I was saying to them, I know I've got a UTI. And it wasn't until 5 week of hospitalisation away from my girls, I'd seen them once during that time. I forget who came in. I think it was a urologist. Urologists, in my experience, are not kind of up with the current treatment pathways for chronic and recurrent UTIs. And it's not their fault, it's because recently
it's a very currently being discovered space,
like NICE has only just, fairly recently had a treatment pathway and even recognised a chronic or recurrent UTI as a condition. Before that, it wasn't recognised. So actually, they would have no way
and
of
what
being
is
able
NICE
to,
for the people listening?
NICE, the National Institution of Clinical Excellence. So NICE is an organisation that basically kind of govern and give guidance to the NHS, for example. So the NHS will look to NICE for treatment pathways, for guidance on, so best practice clinical guidance on XYZ condition. But I think it was only me as a patient really championing, whereas now I have the knowledge. I know that when a GP says, we're going to dipstick your urine, every single time I say to the GP on the phone, even now, don't even bother. It's not going to show anything. I can tell you, don't waste NHS resource. 25% of positive UTIs are going to be negative on a dipstick test. That's a quarter of women that are being misdiagnosed because they're being told it's negative. And that's just even going into pregnancy, when my waters went at 31 weeks, I knew that wasn't normal. They sent me home, no scans after that. No, I had nothing. I had no antibiotics. Obviously, I got a very severe infection. Obviously, I should have been kept in hospital during that time. I didn't know that at the time. I had no bloody idea. When I went into labour naturally at 36 weeks, obviously, Sienna hadn't had any surfactants, so her lungs weren't properly developed. Babies use the amniotic fluid around them to be able to breathe in and out, to practice breathing, and that then develops their lungs. She hadn't had any of that because there wasn't sufficient amniotic fluid. Had they scanned me, they would know that. Had I known that, I would have said, freaking scan me and get me in that hospital, but I just didn't know. So I thought, oh, great, I can go home. I was in agony. I had a severe infection that whole time, which then passed to her. So she was born, she had meningitis. She then has Pseudomonas, which was a hospital infection. She was fighting for her life. She was on a life support machine on a ventilator for 2 weeks. I was angry.
What an ordeal.
I was angry because I was like, if I had known that, I could have stopped that happening. No one tells you these things, and it's only through the self-discovery. And even with my bowels, bowels. So I've had 2 emergency bowel surgeries for bowel obstructions. Three. Have I had 3?
I think 3.
I think I've had 3.
Yeah.
Anyway.
Oh, no, maybe 2 surgeries, 3 hospital
3
stays.
hospitalisation.
Yeah.
Thank you. You're probably with me for every single one. So the first one, obviously, I didn't know what was wrong with me. Clinically, my observations were fine. No high blood pressure, no high temperature, CT scan normal, MRI normal, everything normal. I was screaming.
But you had nothing normal at the same time.
I was screaming. It was worse pain than labour. Yeah. I was literally going crazy. And I was on morphine and they were telling me, oh, you look like you're in more pain than our cancer patients. That's because I fucking well am.
A hell
of
pain.
It was only once I had the emergency surgery and I woke up and the surgeon shook my hand and he said, you were so close to losing part of your bowel because the necrosis, which is where your bowel dies, the intestines had twisted to such a degree that they'd started to die. And that tissue was only just untwisted in the nick of time that left me with a bowel. Otherwise, I would have woken up with a stoma. And the second time this happened...
I remember them making you sign that document to go into surgery, saying basically like you waive your life, whatever that document says.
We don't think there's anything wrong with you.
And you were literally like you couldn't even hold a pen.
No.
And they would like giving you the max amount of morphine that was so close to an over... I mean, I'm being dramatic, but you couldn't have any more.
No, I couldn't.
And you're there crippled in pain and literally having to like sign your life away. And I just think it's this... knowledge.
It's the knowledge makes you be able to help yourself because then the second time it happened, I went straight in. I got in an Uber and I said, I've got a blocked bowel, get me to a hospital. I have 20 minutes to get into surgery. And I went straight into Chelsea and Westminster. Hats off to them. They put me straight in resus. And I said to the guy, you can CT scan me, whatever, it's not going to show up. All my observations you're doing, I know legally, clinically, you have to do them. They're not going to show you anything. Trust me, I have a blocked bowel. This is exactly where it is. You need to do surgery right now or I'm going to lose my bowel. And I remember the guy saying, we have nothing clinically to base this on other than what you're telling us and we're taking you to surgery. And I just burst out crying and was like, thank you. And then when I woke up, same story, like, well done. It blows my mind that I had to learn that the hard way. And that's what we want to try and prevent as much as possible.
We do.
Wellness to the world.
Wellness to the world. And watch this space. There will be so many incredible people that we bring on this journey with us. And we feel blessed to have this network and these incredible people that we work with. And let's just positively impact everyone's health one conversation at a time.
I love that.
Until next time.
Onwards and bloody upwards. If you loved today's episode, please do like, share and follow us on social media.
If you have any comments or questions or want to get involved in any way, please DM us at Health Applied Podcast or drop us a message at hello@healthapplied.co.uk.
Thank you.